Hello, healthy women. Today, I saw a 70-year-old woman in my clinic complaining of profuse vaginal bleeding. On examination, I found a mass protruding from her cervix. So today we are going to talk about cervical cancer. What is cervical cancer? It occurs when an abnormal cell develops in the lower part of the uterus, where we call the cervix. So it happens to 13,000 women per year. So 13,000 new cases are diagnosed every year. Of course, there will be a lot of women out there undiagnosed. When found early, cervical cancer is highly curable. What are the symptoms and signs? Most times no symptoms. But as the cancer progresses, then we start having unusual vaginal discharge. That is the first sign. Unusual is usually watery, smells a lot. And then we can have vaginal bleeding between periods for those women still menstruating. For those who have stopped menstruating after menopause, then they will suddenly start bleeding after the menopause. Or some women will complain of pain and bleeding during sexual intercourse. So anytime we notice these symptoms, please let's raise a red flag. What is the cause of cervical cancer? There's an organism, a virus, that has been linked to cervical cancer 90% of cases. It is called the human papilloma virus. The only thing that can prevent human papilloma virus infection is through the use of condom during sexual intercourse. So that means all women that are having sexual intercourse are at risk for human papilloma virus infection. What are the risk factors? If you're an African American woman, there's a risk. If you are from the Hispanic tribe, you're at risk. If you smoke, then there's risk. If you have many children, like the African women, they have many children. Of course, it means they have many sexual encounters, and so they are at risk for cervical cancer. If a woman has been taking birth control pills for a very long time, more than 35 years, they are at risk for cervical cancer. Then if a woman has HIV infection, which reduces her immunity, she's at risk for cervical cancer. Multiple sexual intercourse, multiple sexual partners are at risk for cervical cancer. So how do we detect cervical cancer? Have you heard of the pap smear? Yes, there are a lot of flyers encouraging women to take up the test we call the pap smear test. For women above 21 years of age, they should do the pap smear test every 3 years, while those that are above 30 to 65 years of age can have a human papilloma virus test as well as a pap smear test. If those are the ways of diagnosing pap smear. If there's an abnormal pap smear, then we'll go further to do what we call a colposcopy. So colposcopy is like looking at the cervical of the cervix under magnification. And so it will show abnormal cells in the cervix. And then when painted with acetic acid, then there will be an aceto-white view that will tell you that there's a lesion on the cervix. Then there's a human papilloma DNA test that can be run for very high risk human papilloma virus, because we have different types of viruses. Some are high risk and some are low risk. It's the low risk type that causes genital warts. A biopsy can also be taken if you strongly suspect carcinoma of the cervix. So here a tissue is taken from the cervix and then sent to the pathologist to look at it and diagnose cervical cancer. Cervical cancer has several stages. We have stages 1 to 4. Surgery is done for very early stage 1, and then radiotherapy, chemotherapy can be combined with radiotherapy for stages beyond 2. During the treatment for cervical cancer, using chemotherapy or radiotherapy, a woman will feel extremely tired, the blood cells are always low, and then she has upset stomach, nausea, diarrhea, and she may not feel well. But after treatment, she quickly recovers and feels better. So the treatment options are surgery, radiation therapy, chemotherapy. Then we have what we call targeted therapy, where the drug is targeted at the blood supply to the cancer cells. So after starving the cancer cells, they wear off. Then we have the immunotherapy, where drugs are targeted at, dealing with the virus and improving your immunity so that your T cells can damage the virus. What are the coping strategies during treatment? The patient should make sure that she eats well and do light exercises so that she can be strong to withstand the treatment. Fertility issues for the younger ones, if it's picked early and only part of the cervix is taken away, then the woman can still get pregnant, and other treatments can be offered during pregnancy, like maybe the cervical sacrilege and all that. Then we have 66% women that survive cervical cancer treatment within 5 years. So survival rate of 5 years for most women on treatment. And then how do we prevent? Prevention is the key to not having cervical cancer. Pap smear test every 3 years until you get to 50 years of age, then we can spread it to every 5 years. But if you've been having negative tests after doing like 3 to 5 yearly tests, then you can spread it to 5 yearly. We also have the HPV vaccines. We have 2 types, the Gardasil and Cervarix. Gardasil has advantage of taking care of human papilloma virus, high risk and low risk. So it can also prevent genital warts. While the Cervarix, we only treat the high risk, we prevent the high risk type. So it doesn't cure, it only prevents. And during the vaccine treatment, please also do your pap smear test, because it doesn't prevent you from having cervical cancer, but it will go a long way to protect you from cervical cancer. Now, we also have avoiding sex if you are not married, because once you don't have sex, you are not at risk for having human papilloma virus. So let's keep safe. Let's protect ourselves from these viruses, because we are all at risk. Once we are having sexual intercourse and we are having babies, we are all at risk. So let's do pap smear test every 3 years. And for older women who have had 3 or more negative test samples, you can do it every 5 years. Thank you. Take care.